Hello and welcome back to Unacademy. So let's get NEET PG. Myself, Dr. Muskan Chaudhary, and just now we covered the theory section of the Pseudomonas. Now we'll cover the MCQs for the same. So that is the continued session. Starting with Unacademy. Unacademy is India's largest learning platform where you get access to both the live and the recorded sessions and learning from the India's topmost educator for any medical examination, be it NEET, PG or PG examination. Compete in the live T&Ds and test preparation with a highly competitive quizzes and the QBanks. Study on the device of your choice from any part of the world and assess up to 25,000 of the MCQs with printed and the digital notes that are being provided. Under Icon subscriptions, Unacademy has come together with the Prep Ladder and we get access to the Clinical Integrated Essential with video lectures, Q banks, and the Rapid Revision Snapshot with 2022 Dream Notes. With live batches, recorded sessions, and the 25,000 MCQs and TNDs and the printed and the digital notes from the Unacademy. For the plus subscriptions, if for 2 year it will be 36,000 and that is 1,500 per month. For 36 months it will be 1,250 and 1,625 for 18 months. And icon subscriptions for 24 months it is 58,500 accounting for 2,438 per month and 1,875 per month for 36 months and 2,875 for 18 months. And do use my code that is Muskan 10 to get 10% of the discount. Next, we come to the raise a hand feature that is something unique to the Unacademy where you personalize your classes to be interactive with one-on-one interaction of your favorite educator and enables the doubt solving with the educator just by raising the hand. Updated highly effective Q banks of 25,000 MCQs and lectures. That is based on the latest examination pattern and detailed explanation. And do use my code that is Muskan 10 to get 10% of the discount. Special class features include the live sessions. You can do the polling for the questions, raise a hand, never miss a class because you will get the notification for the same and do get the lecture notes and the printed and digital forms and read them from anytime and anywhere from your favorite device. For 24 months, 4 months is totally free and with 12 months, 2 months is totally free and with 6 months, 1 month is totally free and do use code that is discount 10 to get 10% of the discount. Now we'll start with the Q banks. We'll get around 15 seconds for every question. So which of the following are not the general characteristics of the Pseudomonas species? That is it is a rod shaped curved or it is motile that is found in the soil and water and the plants and all the species causes the disease in the humans only. So which of the following is not the characteristic? So what is the correct answer? Which of the following is not the general characteristics? Now coming to each of the option. It is a rod-shaped curve. Yes, they are motile. Yes, they are motile by monotrichous flagella. And they are what? Rod-shaped negative. Now they are found in the soil and the water, and all the species not only cause the disease in the human but in the animals also. We read about the Burkholderia melli that is actually causing the disease in the animals, that is the horse, and apart from the humans. Now, Pseudomonas aeruginosa produces a water-soluble blue-colored pigment that is called the pyocyanin, and dash-colored pigment that is the pyoviridin. So, what is the color? It is the green. Is this a blue-green? It is the red or the pink-red. So, take your time and just let me know the answer. Yes, so what is the answer? Now, the question is saying that the pyocyanin, we remember that 100% of the strains of the Pseudomonas produces the pigment, that is the pyocyanin. Then we have the pyorubin, then we have the pyoviridin, and we have the pyomelanin. So pyocyanin that is producing the blue-green diffusible pigment. Then we have the pyorubin R4R that is the red pigment. Pyoviridin that is the yellow-green colored pigment. And melanin that is what? Brown, black colored pigment. So what is the answer? That is the yellow-green pigment is what? Pyoviridin. Now, patient with the cystic fibrosis infection suffers from a chronic lung infection caused by the Pseudomonas. The bacterial growth results in the formation of dash in the host cell, that is a pigment, biofilm, white blood cells, and the endotoxin. So, what is the correct answer? Yeah, hi everyone, and hi Kamal. So, please just let me know the answer in the comment section for the question. Yes. So, what is the answer in this case? The patient with the cystic fibrosis. When we read about the capsule, when we read about the slime and the biofilm, remember that the slime is irregularly arranged glycocalyx around the bacteria, and we get that in the staph, in the streptococcus mutants, and the Pseudomonas aeruginosa. All right. Now, in the Pseudomonas aeruginosa, in the cystic fibrosis, the slime that is produced is known as the alkyd, and they forms what? They forms the biofilm. They forms the biofilm that is responsible for the causing what the infection in case it is an opportunistic infection and mainly in the immunocompromised people. That is the biofilm. That is the violence factor. We are talking about the violence factor that is the produced in case of the cystic fibrosis, that is the biofilm. All right. Now, pigment is always produced by the Pseudomonas, so that is not the violence factor. Which of the following temperature and incubation period is the most optimal for the bacteria? That is the 42 degrees Celsius for 48 hours, or 37 degree for 48 hours, 42 for 24 hours, or 37 for 42 hours. So which of the following temperature incubation period is most optimal for the bacteria? We are here talking about the Pseudomonas. It is not a general question, and being asked in the examination also chances are low because temperature range for the bacteria are rarely asked. This is the 42 degrees Celsius for 48 hours. Now moving to the next question. All of the following statements about the Pseudomonas are true except that it is oxidase positive. It doesn't grow well at 42 degree Celsius, and it is a common opportunistic pathogen, and it contains the fimbriae. So which is not true. Easy one. So which of the following statements is not true? Now when we talk about the Pseudomonas and the biochemical reaction of it, we need to remember that they are what? They are oxidase positive, and that is the color changes to that of the purple in just 1 to 2 minutes, and they are also what? Catalase positive. They produce the enzyme catalase and convert H2O2 into H2 and water, and we see the bubble formation. All right, so that is the catalase positive and the oxidase positive test, and as well as nitrate reduction test, that is positive. So pseudomonas, they are oxidase positive, that is true. It is a common opportunistic pathogen. Yes, it is a community acquired as well, and the nosocomial infections as well. In the community, we have the external otitis media, that is also known as the swimmer's ear. Apart from this, it causes the corneal ulcer in that of the contact lens bearers. Most common cause for the corneal ulcer in that of the contact lens bearers. And it causes what? The Shanghai fever. It also causes the hot tube folliculitis, that is the generalized folliculitis or the jacuzzi folliculitis. This is what the community. When we talk about the nosocomial acquired opportunistic infection in the mainly in the immunocompromised, commonest cause for the burn infection. Apart from the, it causes the wound infections, and ventilator associated pneumonia causes the UTI after post catheterization, and causes the after post tracheostomy, and that causes the infection, and the cystic fibrosis. This is also true. It is contains the fimbriae. Yes, it does contains the fimbriae for the additions, and it grows well at 42 degrees Celsius. Now moving to the next question, that Pseudomonas aeruginosa is responsible for one of the common nosocomial infections primarily seen in the immunocompromised people. Which of the following route Which of the following route has a higher risk of transfer of the pathogen to a susceptible patient? Is surgical procedure or the contaminated ventilators, air drops, or all of the above? Apriya. So what is the answer? The Pseudomonas aeruginosa is responsible for one of the common nosocomial infections, and which of the following is the higher risk factor? For the pathogen, that is a surgical procedure, contaminated ventilators, air droplets, all of the following are the root of the infection for that of the Pseudomonas aeruginosa. The main structure component, that is the pili or the fimbriae, is important in the virulence factor of the Pseudomonas aeruginosa. Which of the following is not the most common pathogenic factor? It is the hemolysin or the pigments or the lipase B or the extracellular protease. So, which of the following is not the common pathogenic factor for the Pseudomonas? So what is the answer? What is the main structure component that is important in the valence factor? Now, when we talked about the valence factor, we talked about the slime that is present. We talked about the biofilm that is produced. We talked about the endotoxin and the exotoxin A that has the property similar to that of the diphtheria toxin and is responsible for the inhibition of the protein synthesis. For that, we had the mnemonic that is don't synthesize the protein. That is D for diphtheria toxin, S for Shiga toxin, as well as EHEC toxin because it also has a Shiga-like toxin, and P for Pseudomonas. All these causes the ATP ribosylation and inhibit the elongation factor to it, diphtheria toxin as well as this Pseudomonas. Apart from this, it had the hemolysin that was an important valence factor and the exoenzymes that is the extracellular protease and pigments, but it doesn't have the phospholipase B activity. Alright, if the pigment was the only option and phospholipase B was not in that, we could have gone for the B, but phospholipase B is not found by that of the Pseudomonas aeruginosa. Coming to the next question, all of the following gram negative bacteria are common pathogens associated with nosocomial infections except the Acinetobacter baumannii or the Klebsiella or the Pseudomonas or the Candida. So this is an easy one. That question is saying the bacteria, and we have one of the options that is not the bacteria, that is the Candida. So this is obviously Candida is a fungus. It's not a bacteria. And all of the following gram-negative bacteria are common pathogens of nosocomial infection, and the most common one is the Pseudomonas. Which of the following is not the general characteristic of HCK, that is the Haemophilus, Agrobacter, and Cardiobacter, Echinella, Kinginella. That is normal flora of the oral cavity requires CO2 for the growth and grows well on the McConkey agar and the causative agent of the infectious endocarditis. Okay, so I'm audible now. Is there any connection problem? So, which of the following is not a general characteristic of the HAC key? Now, they are normal flora of the oral cavity. This is true. So, which of the following is not a general characteristic of the so they are normal flora of the oil cavity and they require the atmospheric atmosphere that is enriched with of CO2 for their growth. They grow well on the McConkey agar and they are the causative. They do cause the infective endocarditis, but only in cases of 1%. So coming to the best of the option, we have to select the best one that is the causative agent for the infectious endocarditis. Coming to the next one. Uh, Pseudomonas aeruginosa is becoming more resistant to the antibiotics over the years. Select all the important drugs that is used in the treatment of the UTI that is caused by the bacteria. It's azithromycin, norfloxacin, cephalosporin, or acetaminophen. So what we give Pseudomonas aeruginosa, the resistance that so what is the answer in this case? That Pseudomonas aerogenes is becoming more resistant to antibiotics. Now, important drugs that is used for the Pseudomonas aeruginosa. Now, one we give is the acetaminophen, that is the painkiller that in case given in the mild to moderate pain, and norfloxacin that is given along with this. All right, in case of the UTI infections. Now, moving next, which of the following are the most common gram-negative bacteria that is found in the specimen that can grow in the burnt wounds or the skins? So that is the Streptococcus epidermis or the Pseudomonas aeruginosa or the Acinetobacter baumannii or the Moraxella catalyst. So which of the following are the most common gram-negative bacteria that can grow in the burnt wounds or the skins? So what is the answer? We already read the Pseudomonas aeruginosa, that is the opportunistic nosocomial infection, positive agent for the opportunistic nosocomial infection and associated with the ventilator associated pneumonia and the most common burn infection and also the post catheterization causing the UTI and cystic fibrosis as well as the wound infections. Now, Acinetobacter baumannii is most commonly found in case of the chickens, soil, mice, or the bats. So that is found where? In the soils. Now, which of the following bacteria is a small capnophilic gram-negative oxidase positive bacillus that can be isolated from the human bite infections? That is Echinella cordons or the Moraxilla or the Protease or the Burkholderia melai. Which of the following bacteria is a small capnophilic gram-negative oxidase positive bacillus that can be isolated? What is the answer? We are talking about HACEK group. That is what? That is the capnophilic one. So that is what? Echinella. Capnophiles are the microorganisms that can grow in the higher concentration of what? Oxygen, sugar, CO2, or the pH. So capnophilins are one organisms that grow in the higher concentration of what? CO2. The following bacteria is an opportunistic pathogen that is commonly isolated from the hospitalized patients with the chronic lung infection is also primary plant pathogen. So that is Enterobacter aerogens or the Burkholderia capicea or the Pseudomonas or the Acinetobacter baumannii. So which of the following is an opportunistic pathogen as well and associate with the plant pathogen also? What is the answer? The following bacteria is an opportunistic pathogens, but what the catch point is that along with the animal pathogen, it is also human pathogen, and as well as the plant pathogen. That is, we are talking about the Burkholderia capicea. That is mainly in case of the onions and the bananas. That is the pathogen of the onions and the bananas. That is for the Burkholderia capitio. Now, all of the following statements are regarding Acinetobacter are true, except the primary pathogen is nosocomial infection, ubiquitous in nature, causes skin infection susceptible to most of the antibiotics. Yes, so what is the answer? Which of the following is not to accept? It is a primary pathogen, nosocomial infection, yes. And we have that is a HACEK, that is a nosocomial infection list we had. It is a nosocomial infection, this is true. It is ubiquitous in nature, that it is found everywhere. It causes a skin infection and it is resistant to most of the antibiotics. Now, moving to the next one, which of the following gram-negative bacteria is an important plant pathogen? That is Pseudomonas syringae and the Burkholderia glandos, Fusarium species, and the this Capnocytophaga species. Now talking about the plant pathogen one, we read about the Burkholderia capicea. Next we have the Pseudomonas. syringe. Now, move to the next one. Name the bacteria that is used in the biomedication agent that has the ability to degrade the organic solvents such as the toluene. That is the Pseudomonas syringae and the Acinetobacter baumannii, Pseudomonas alkaligenes, or the Pseudomonas putida. Yes, so what is the answer? It is the Pseudomonas putida. Pseudomonas aeruginosa is resistant to most of the antibiotics. That is mainly due to the chromosomal encoded antibiotic resistant genes and that of the bacterial cellular envelopes. So that is the low susceptibility, high permeability, low permeability, or high susceptibility. Yes, so what is the answer? It is due to what? Low permeability. It is due to what? Low permeability. So we are done with the MCQs. Barely we had 20 MCQs for the Pseudomonas. Quickly see the revision for the Pseudomonas so that we'll end the session in 10 minutes. So what we need to know about the Pseudomonas is that it is motile and it is motile by peritrichous flagella. Monotrichous flagella. All right, it is what? It is a gram negative road. And what else we need to remember? That produces the slime and forms the biofilm. Therefore, in case of the cystic fibrosis, the slime is known as the algate. Now, next is that this is what? Mucoid in nature. Next, when we talk about the biochemical reactions that we need to remember that it is catalase positive and oxidase positive. So the changes color to that of the purple. Next is that they are nitrate reduction test positive. And on the McConkey agar, they are non-lactose fermenters. On the cetrimide blood agar, they show what? They show the sweet, fruity, grape-like smell. All right. Apart from this, they produce the pigments that are important to remember. They produce the diffusible pigments, that is pyocyanin, pyoviridin, pyorubin, and what is pyomelanin. So pyocyanin, that is blue-green pigment. Then we have the pyoviridin, that is the yellow-green pigment. Then we have pyorubin, that is the red pigment, and the pyomelanin, that is the brown-black pigment. All right. This was the pigment. Then we have the valence factor, that is having the slime. We are having the pili for the addition. We are having the hemolysin. We are having the endotoxin, exotoxin A, that is inhibiting the protein synthesis. All right. And quorum sensing feature, that is there when the concentration increases of the bacteria, they causes the cell to cell communication. Now next we come to the clinical symptoms, that one is what? One is the community acquired one. So that is the external otitis media, mainly in the swimmers, therefore known as the swimmer's ear, causes the corneal ulcer in the contact lens bearers, causes the Shanghai fever, enteric-like fever, that is, and causes the generalized folliculitis, which is also known as hot tube folliculitis or the jacuzzi disease. Talking about the nosocomial, talking about the nosocomial infections, that mainly in that of the immunocompromised people, and most common cause for the burn infections, and causes what? Ventilator associated pneumonia, and UTI in post catheterization. Cystic fibrosis, infection in case of the post tracheostomy, and shows the multiple drug resistance, which is what? Which is plasmid mediated. So this is the nosocomial infection list by the Pseudomonas, that is most important burn infection, and the patient will have what? Green exudates. Apart from this, also causes what? Thyma gangrenosum. Now, now talking about the treatment, mnemonic is kill pseudomonas with campfire. What is this? C4 carbapenem, A for aminoglycosides, macrolides, polymyxin, fluoroquinones, third and the fourth generation cephalosporin, and what is extended penicillin. That is kills pseudomonas with the camphor. This is the treatment. So this was it. One, we talked about the stromboid fish poisoning, that is due to the conversion of histidine to that of the Histamine. Histidine is present in the scorboid fish group, and in the presence of the improper refrigeration, the bacteria multiplies and causes the conversion of histidine to histamine. That is a scombrotoxin, and mainly that is responsible by the Pseudomonas scombrotoxin, and the patient will present with the burning, nausea, diarrhea, palpitation, and the skin flushing. Now, oxidase test is important to remember, that is positive for the Pseudomonas, and you can clearly differentiate the positive test with the purple color in 1 to 2 minutes. Cetrimide blood agar, that will show the grape sweet fruity like smell. These are the diffusible pigments by the Pseudomonas. This is the pyoveridin, this is pyocyanin, and the pyorubin is the yellow green pigment. Then we have the pyocyanin, that is blue green pigment, and we have what? Pyorubin, that is what? Red pigment. Otitis is the swimmer's ear due to the moisture, excess moisture. Pseudomonas most common, then staph, streptococcus, and patient will present with what? Maceration and inflammation. This is a generalized folliculitis, that is hot tube folliculitis or jacuzzi disease. So, these are the list of the disease by the Pseudomonas we have already covered, and these are the valence factors, that is adenosine, thick biofilm, pyocyanin, pyoveridin, endotoxin, exotoxin with multiple drug resistance, and these are the list of the disease. Green exudate in case of the burn wound infection, ecthyma gangrenosum, nosocomial infections, and the malignant otitis externa in the swimmers. Then we have the Burkholderia melli, that causes the animal disease mainly in that of the horse, and it is non-motile, and human it causes what? Glanders disease. Causing what? Glanders disease, that is a Burkholderia melli, and this is the Burkholderia pseudomelli, causing what? Melioidosis, and also known as the Whitmore disease or Vietnam bomb. Vietnam bomb or the Whitmore disease, that is the melioidosis. Alright, and both shows what? Bipolar staining, that is what? Safety pin appearance. We have the list for the safety pin appearance, that is Yersinia vibrio parahemolyticus, that also shows the swarming motility along with the protease. Then we have Burkholderia melli, Pseudomelli, and the Klebsiella, Yersinia H. ducreyi, and the Campylobacter granulomatis. So, thank you for today's session, and do use my code, that is Muskan10, to get 10% of the discount. And do not forget to enroll into NEET PG Combat, that is to be held on 28th of November at 5 p.m. You can get up to 100% of the scholarship, along with that of 20,000 of Amazon vouchers. All you need to do is to enroll into that on the Unacademy app or onto the website, and use my code, that is Muskan10, to get yourself enrolled into the examination scholarship program. So on the basis of the all India rank, you will get what? You will get the this scholarship on the basis of all India rank. So please press the best icon. Do like the video and do subscribe and share. So I will see you tomorrow in the tomorrow session. So take care and bye bye.